Hello, this is Mayor Bob Odekirk. We're back here doing our bi-weekly COVID report. So I want to thank you for joining us and thank the Joliet Fire Department for these reports, especially Deputy Chief Jeff Carey, who's responsible for compiling the data and getting it out to our citizens. The news about COVID as an overview would be that the numbers are still much lower than they were before. However, once again, we are seeing an uptick in COVID cases here in our community. So the numbers are significantly lower than they were back in April or May. They are rising. It does appear that the rise seems to be with younger people. The issue, though, the concern is that young people can't spread the disease to other people who may have a difficult time, either have to be hospitalized and get very ill from disease or succumb to it. So I just will remind all Joliet residents to do the things that we've learned the last few months regarding social distancing, regarding wearing masks in public, the responsible behavior that our residents, that we've all done to help fight the disease. It's not gone, the virus is still here, so we still have to be mindful of the effects of it and practice the things that we've been doing so far. So again, thank you for coming and viewing this. And thank you to our fire department for putting this together. And I just want to thank all Joliet residents for being responsible and working together to help our city and our community fight COVID and hopefully eventually get past this where we have defeated COVID. But thank you, everyone. I appreciate it.
Hello, this is Deputy Chief Jeff Carey with the Joliet Fire Department with the City of Joliet COVID update for August 7th. We get all of our COVID-related numbers from the Will County Health Department, the Illinois Department of Public Health, and the CDC. You can visit their websites for additional information. There have been a total of 2,243 residents of Joliet who have tested positive for COVID-19 with 136 deaths since March. 369 of these positives are from the Joliet nursing homes, as well as 74 of these deaths. Our 2-week average of new cases was at its lowest the week ending June 26 at 102. We have been inching higher each week to a current 2-week average of 205. This does come as the amount of testing has also increased, but we still do need to remain cautious. At the end of May peak, the county was testing around 6,000 people per week. The county is now testing around 10,000 people per week. At the present time, we are seeing the largest increase in the 20-year-old and teenage groups. The 20-year-old group has now passed all other groups for the total number of positive cases in Will County. They have gone from accounting for 7% of cases in mid-April to accounting for 18% of those cases now. We need to remember that while most of the younger population usually does not get very sick from the virus, some can and do. They still do get the virus and can spread it to the older, more vulnerable age group. I talked with the local hospitals this week to see how they were doing. They have just started to see a small increase in the number of COVID patients coming in after being at their all-time lows. They are still far from the numbers they were seeing in April and May, but wanted to remind everybody to keep practicing the CDC guidelines. They do have plans to handle an increase if we should see a resurgence into the fall. The good news is the hospitals are starting to operate near normal again for procedures and inpatient care. Some of the nursing homes in Joliet have also seen their first increases in a while after being stable for the last month. 4 out of the 8 nursing homes in Joliet seen an increase in COVID positives last week with 2 additional deaths. Even though these increasing numbers are coming while we are testing more, it is not the way we want to head. We should use this as a reminder that while we are doing better, we still have a ways to go before this pandemic will be over. In order to stay healthy, get out and enjoy ourselves, keep businesses open, we need to keep following the CDC guidelines. While it is not convenient, wearing a mask and social distancing are the best things we can do. We do not want to revert to a point where more restrictions are needed. As this pandemic continues to go on, it can cause a lot of stress. I reached out to John Lucancic from the Joliet Fire Department Peer Support Group for the following information on dealing with stressful times. Please remember that it is normal to feel increased stress levels, anxiety, isolation, and even depression. Recognize that stress affects all of us in different ways and for different reasons. Please be mindful of the stress reactions of your family, friends, and yourselves during this time. Reactions may include changes in eating, sleeping habits, excessive worry, difficulty concentrating, or increased use of alcohol. Establish and maintain open lines of communication with those you care about and talk to them about common reactions. This includes your children. In addition, develop and use healthy coping strategies to manage stress, such as exercise, meditation, or other hobbies. Finally, if you do need help, there are resources which you can turn. Visit coronavirus.illinois.gov for a list of mental health services. Thank you for being with us today. Stay safe, stay healthy, and we'll see you again in 2 weeks.